Blog Talk Radio.
Welcome to Women Who Rock Investigates, where branding just got even better for women. Our media source provides case studies in the areas of health, policy and government, human resources, and more. Our experts are handpicked with credible information to validate the latest in these studies. Join us each Tuesday at 10 a.m. Central Standard Time after Women Who Rock with Success. Now, let's go to the show.
And good morning, and welcome to Women Who Rock Investigates. And this is your show host, Ms. Diane Winbush. And so thank you for tuning in with us on the broadcast today. And, of course, we are diving into some more important things that, cases that affect many people around the world. So today we have a specialist with us that's in the studio, and it is none other than Dr. Joanna Lewis, and she will be discussing with us in regards to opioid drugs. That name always kind of tripped me up. So good morning and welcome to the show, Joanna.
Hi, thank you. I'm so happy to be here.
Okay, perfect. And so, and I did not share with the audience about you're a pharmacist and all of that, so here's the time. I'm going to let you explain that to them. And so tell us a little bit about you.
Okay, so like you said, my name is Joanna Lewis, and I am a pharmacist. I've been practicing for a little bit over 10 years, and sort of as a passion project, I have a blog and a social media presence called the Pharmacist Guide, where I try to promote. I just try to promote wellness topics to a lot of people. I know pharmacists are usually accessible, and we get a lot of questions. So just trying to make it a little broader. As far as my role as a pharmacist, I've worked in a lot of different healthcare settings. I've worked at your community pharmacy at Walgreens, and I've worked in a hospital pharmacy. Right now I've kind of transitioned into the compliance and regulatory part.
Okay, great. So what was your, drive for wanting to launch into medicine?
I think, to be totally honest, I don't like blood, so I think nursing and being a doctor was kind of out of the picture. But I've always really been interested in how, like, the mind-body connection works. And I've always loved chemistry and science, so I think pharmacy was a good fit. I did a lot of research and talked to a lot of people and shadowed people, and I really like how pharmacists are positioned to be kind of at the front lines of patient care and to really be able to talk to people.
Okay, great. So tell us a little bit about what you actually do, where you are stationed at as of now. And then after that, the next question would be, tell us a little bit about the Pharmacist Guide. So we can get in more depth about what you actually do to bring us forward to discussing in regards to the topic of the opioid epidemic.
Absolutely. So I got my MBA in pharmacy school. There was a joint program. So I've always kind of been interested in leadership and administration and just kind of the management of pharmacy, and specifically in compliance. I think building good processes for pharmacists will make us more efficient and keep the public safer. So I work right now, it's called 340B, but really I kind of manage a compliance program that makes sure our purchasing goes to the correct person. Like when we order medications, it's a government-sponsored program. And then I also work, pharmacy and medicine and hospitals have a lot of regulations that they have to follow, and it's all under the umbrella of patient safety so that we do the right thing for patients. So I just help manage the systems behind that to keep essentially the patient safe.
Okay. Okay, and so was
And
this a part of something that kind of developed into you doing a little bit further in the as far as compiling the pharmacist guide for I guess your audience?
there's a little bit of a bridge. So I've always been interested in compliance, and
Mhm.
my past job, I worked at Duke University, and one of my main jobs there, we kind of had to benchmark and I had to reach out to a lot of other organizations in a lot of other states to see how they were doing, certain processes.
Mhm.
And
Cool.
the more I reached out, yeah, it was really interesting. It got me out of my comfort zone. It let me network a lot. But also, at that time, this was probably 6 or 7 years ago,
Mhm.
the pharmacists weren't really in social media. There wasn't really a big presence there. And I thought this would be a great way to connect with people. I have a good platform, a good message. A lot of people are asking me, especially in healthcare, there's a big high instance of burnout. And I saw that front line. Like, everyone can get very bogged down. It can become a very negative
Mhm.
atmosphere. And I was
True.
thinking, yeah, very true. If I could infuse some positivity into this, then, I'm making a difference. So that was my initial goal, just to connect and maybe just put a positive spin, make people feel a little better. And it kind of developed into a personal journey, which is where the pharmacist guide came into place. I really started about this time I started having children, and I know that kind of throws the work-life balance off. I think as women we kind of have to find ourselves again, or find our new normal. So I kind of exactly. So I had to develop habits that, I can't just exercise whenever it's convenient. I have to build it around my family's schedule and, making good nutrition choices. And, sleep is impossible to get, but trying to build good sleep habits in. So I just try to kind of spread that knowledge to other people.
Absolutely. A lot of individuals perhaps may not be aware that sometimes when you even go into your local pharmacy, pharmacists have the same, I guess, authoritative figure as, as a actual doctor, because I know I have went into several pharmacists, and they can be able to give advice on certain drugs, give advice on certain medicines that you can be able to take. So that's the reason why we just plugged you on in today, because it's very important of the knowledge of a pharmacist has just as much as as a doctor. And so even though you are a doctor, but what I'm saying is sometimes individuals may say, well, I have to go maybe to the ER or what have you, but sometimes you can be able to go to your local pharmacist, and they can be able to also direct individuals if they have like a immediate emergency issue that's going on. They can be able to subscribe some sort of substance that the individual can be able to take if it's like something like a quick medical care or something like that. So that's just
Definitely.
something I just Go ahead.
Well, or no, I was going to say a lot of people don't know. So like you said, we have our doctorate, and our physicians go to medical school for 4 years. We go to pharmacy school for 4 years. And in our doctorate program, ours is a lot more focused on medications. But physicians maybe have 1 semester, maybe 2 if they're lucky, on pharmacology, whereas we have pretty much 3 solid years. So our medication knowledge is a lot deeper. Not to say that physicians definitely know what they're talking about, but usually they kind of just know their specific little area, and they don't always know how one medication in their specialty will affect maybe something you're taking for something else. So that's where we're able to help. And like you said, when people come into the pharmacy, I know a lot of pharmacists who've had people who've honestly saved lives because someone came in with a question and they were able to say, listen, this is much more serious than you think it is. You need to go to the hospital right now. Or we're like, under our license, we're not allowed to prescribe or diagnose, so that would have to be under a physician. But we can, almost triage in a way if we have the knowledge to do that.
Absolutely. And I wanted to kind of reflect on that for just a second before we go into the crisis that is pilfering America as today. But I think it was years ago. My oldest son is about 30, and so I think he was crying one time, and I couldn't figure out what the problem was, and it was a local drugstore, and they do some pharmacists have a little bit more in depth of the medicine more than the physician does, and so once I took him to the nutritionist, she was like, "Oh, what is that medicine?" She did not even know what the medication was, and she was a doctor and a nutritionist, but the pharmacist knew, and they did not prescribe it, but they suggested it. So that's the reason why that's very important for individuals to be able to know that a pharmacist does have the knowledge and the tools and resources to be able to give if it's something like a triage issue, or it's something quick that you may need to stop, or maybe your stomach is hurting or what have you. So sometimes we may look over the pharmacist and we just go straight to the doctor, but the pharmacists have a lot of knowledge to be able to give to individuals that just come right in the door and as needing something quick just like that. And so I just really wanted to point that out because that's very important. So
thank
we're going to get yes, it is. And so let's get into opioids. What does opioid mean to I guess the drug industry?
Okay, so basically opioid drugs just mean that they derive from opioids. So traditionally, or the opium plant is the poppy plant. And I think that's a lot of times people don't recognize that opioids come from or derive from opium. But they really work on the opioid receptors in our bodies. And the main thing that we associate with that is the pain relief. They have other effects, but the main ones that we really obviously focus on are pain relief. I think the ones that people think of initially are heroin, morphine, oxycodone, hydrocodone, and codeine.
Okay. And so in your terms, why has this became like a crisis? Because I know we can take anything and we can abuse the effect, of it because it makes us feel good, or it perhaps maybe take away the pain or take away the anxiety or take away the frustration and stress that sometimes individuals develop on a daily or weekly basis. So why has this drug gotten out of hand so to the fact that it has become an epidemic with the CDC?
I think that's such a loaded question, and it's a good question.
Okay.
But I think there's a lot of finger pointing. Like some people say it's the manufacturers, they're overproducing. Some people think, the doctors are overprescribing. And some people say the pharmacists aren't, screening well enough. And it's, I think, a multifaceted thing. A lot of it is, and there's, again, with those three areas, they also are starting to put recommendations into place to target everything. And I can talk about that later, what we're doing. But I really think, I started working in a retail pharmacy as an intern back in like 2005. And the drugs that we dispensed the most were all the opioids. It was pretty heavily, prescribed back then. And I think, again, it's such a loaded question. I don't really think there's just one factor. I think it's a lot of different things that have contributed to it.
That's fine. That's fine.
But
okay, and so go ahead. I want you to finish because I want the audience to be able to get because some people have became actually outraged about this, and also for some physicians have been incarcerated from behind this. I'm not for sure as
Yes.
to are they are aware of what they are dispensing to the patient, or is it something where it's a such a popular drug that they're not they're not paying enough attention. So take for example, like if I even go into the store and desire to purchase maybe like a cough depressant or something like that, once I lift this lid in the Dollar General store, it's a bell that's going to go off. It's going to let them know that I'm in there, trying to tangle with their medicine. And so I guess that's the reason why individuals are so concerned today. They're trying to figure out why is it that the pharmacists may not be aware of how much they are prescribing due to the fact of the milligrams that are consistent in the drug. They may be concerned about the fact as to how did my child get addicted, because you see it a lot more in the younger generation than you do in the older generation. And so that's what we're here for. We're trying to get answers as to how to be able to diffuse this epidemic and to be able to bring answers so individuals can be educated as to where does the line is drawn.
Well, and it goes back to, like, if you say you take oxycodone because you had dental surgery or something small, like a lot of the usage that turns into misuse or abuse or addiction starts with maybe a small innocent, like, oh, I broke my leg, so I was on pain medication. And then physical dependence on opioids is a natural, real thing. Like, it's not just pretty much everyone. If you take opioids for long enough, which is usually maybe 7 days, you have a physical dependence. And that means if you stop it abruptly, you're going to have withdrawal symptoms. You might feel nauseous.
Oh, wow.
Yeah, you might sweat a lot of times, and then you have the craving. It's like your body craves that. So I think that's where the line goes from physical dependence to addiction. Some people, I think, and a lot of people will take an opioid and they don't like how it makes them feel. But I think, and that's why I think they're starting to regulate doctors, and a lot of states are passing laws that if you have a small dental procedure, or, if you have a C-section, or if you have a small surgery, the doctor's only allowed to prescribe you opioids for 3 to 7 days. In the past, I don't think really people thought about it, and they would just give everyone a 30-day supply and maybe a refill, even if you got your wisdom tooth out. Like, I got my wisdom tooth out when I was 18, and I remember getting like 30, which I didn't use. But, I think in the past people just never thought about it.
Okay.
But now they're really regulating that so people hopefully don't get to that physical dependence. But then the addiction side is actually when you start to have behaviors like what we think of as drug-seeking behaviors. You might, it might affect you socially. You're seeking out your next high, and it's what we think of how people, when their behavior changes. So that doesn't affect everyone, and there's not really a rhyme or reason why some people it affects and some people it doesn't. I mean, we have a lot of risk factors for that, but I really think it could impact anyone. So, and we can talk more about that, like the support that goes along with that and recognizing those behaviors and just getting people the help they need. And I think a lot of parts, at least a lot of the addiction that I see, most people really do want help, but it's the systems might not necessarily be in place, or they'll get help for 30 days and then they're kind of just thrown back at it. So I think that's kind of where healthcare and families come into play to just support these people who are trying to get better.
So this is not something that just evolved. This is something that has been used in the medical industry for years, but it's just perhaps something that they may use more frequently in, hospitals, I guess I want to ask, like as far as the examples that you shared, maybe you're getting a tooth pull and you may have to go up under some anesthesia or something like that, because it's probably a lot of medicines that a lot of us take and perhaps may not be aware of it, when we're getting an outpatient or inpatient procedure done. So I guess that would be the next question as the history, and I don't want to go too far off the topic, but I guess the history of how it came to play and why it has become such an epidemic, because I know some things just don't start overnight. It's just perhaps maybe a pattern. Yeah.
I mean, opioids have been around, like the poppy plant and opium has been around for hundreds of years. And then the like synthetic opioids, which are what we think of when we think of prescription drugs. I mean, I think like the early 1900s, like they've been around for a long time. Like formulations have changed and we've developed different formulations, but as what we think of it, it's been around for a long time. I just think, when I grew up in the 80s and 90s, that time, people weren't it wasn't on everyone's radar. So I think if someone had chronic back pain or chronic pain somewhere, they just would continue to give them refills and not really. And doctors, I'm not saying anything negative, but I don't necessarily know if certain doctors aren't trained in chronic pain, and their family doctor the patient will go to their family doctor and say, my leg has been hurting me for, 2 months. And so a doctor will just write a prescription to help them. And then it just becomes something that they keep refilling. So, and when I worked in the pharmacy, I saw a lot of patients who would go to like five different doctors in a week and get 5 different prescriptions for maybe oxycodone, and it wasn't monitored. So one doctor didn't know that they had already received it. That's changed now because there's a national system in place that tracks all of that. Doctors have to they have to put their prescribing habits into a system, and pharmacists can access that. So I could see now if I was going to give you, 30 tablets of an opioid, I could see that, you just picked up 30 yesterday from this doctor and this pharmacy. So maybe I would question giving it to you. But those tools weren't in place 10 years ago. Like, there's things that we're just now starting to put into place. So I think we're kind of right now in a reactive stage trying to fix it instead of, like you said, it kind of got out of hand very quickly. But and another thing that we're trying to do, or naloxone, which will help if you know somebody who you think is abusing opioids. I think it's always beneficial to even have a naloxone dose with you. And maybe we can talk about how people can recognize like the symptoms of opioid abuse or overdose.
Absolutely, because that is – go ahead.
I think that's one of the biggest things that we're able to intervene on. One of the effects of opioids, it takes away the pain, it makes you feel good, but it also decreases your breathing. Like your respiration rate goes down, and that's really how people die. They essentially take so much of the drug that their breathing stops, so they stop breathing. So naloxone, when you give that, it completely reverses the receptors. It kind of takes those opioid drugs out of the opioid receptors and reverses that effect very quickly.
Okay.
So I think everyone should be aware about that drug. And it's available at pharmacies. You don't need to have a prescription for it, which is one of the big things that has happened over the last year or two.
I absolutely agree. And I guess the next question I wanted to dive into as well as far as, here in the South, we have a large crime rate of individuals breaking into pharmacies and getting that drug is specifically, and perhaps maybe, to sell out to other individuals on the streets. So take, for instance, if a parent is not aware that their child may be taking this type of drug, I guess some of this question you have already answered, but what are some of the signs that they can be able to look for? Because as you stated, after taking it for 7 days, there will be some sort of withdrawal system or withdrawal effects that will be up on the person. So in regards to that, what are some of the signs that a parent can be able to look for if they are suspicious of their child that's even taking this drug?
I mean, as far as like physical changes, your pupils get really large. So I think it's called if people can see that. And I think, you're drowsy. It makes you drowsier. Hopefully people aren't driving when they're on these medications. But I think as a parent, just you know your child so well, so you know when there's like a behavior change. And sometimes there's a weight loss that goes along with it. Sometimes your child will become less social, or they'll want to kind of withdraw a little bit. I think just being in tune with them and understanding, I think they're going to start to crave that drug and that high. And I do think it affects children a little easier because they're more, when we think of how we were when we were teenagers, we definitely, at least I was very impressionable. So you kind of can, you might grab onto something and stay with it. It's a little harder if you don't have the support, or if you don't feel like you can maybe necessarily talk to someone, or if you don't have the good friends who can pull you out of it. So I think just recognizing our children when they start to change, and maybe just asking questions or being there for them, which is easier to say than to do when they're, fighting us back. But
yeah, I could go ahead. I'm sorry.
No, you go ahead.
No, you go ahead. Go ahead and finish.
Well, I was just going to say there's a lot of resources, especially as this becomes more prevalent. States are starting to recognize the importance of having local chapters and local support groups. So even I can give you some, or even if you do an online search, there's a lot usually of addiction centers that support the families and support the people who are using the drugs.
Okay. Well, I guess the next question would be in regards to that. We have identified the drug, opioid drugs, and we have identified the symptoms. We have identified what the parents can be able to look for, and then we've also identified the factors of all of this is really just not actually the doctor's fault. So I guess sometimes the doctor will be blamed for something, but due to the fact that the database, there is a database to be able to detect whether an individual is being prescribed more than once or twice, for the same specific drug. And so do you see, in your terms, because you're right there with all of the medicine, do you see a reduction that could possibly come in the near future in regards to this drug?
Well, and as far as the database, that's kind of a new development. So 10 years ago we didn't have that, which is when, a lot of this started to happen. But I do see the doctors getting a lot more education. I know it's kind of become mandatory that physicians get education on this because, like I said earlier, a lot of doctors weren't used to prescribing. Their specialty might be diabetes or cardiology, but their patient always has pain too, so they're just trying to help with that. So they're making all doctors get educated on, the signs of addiction and physical dependence. And, a lot of states are setting laws that you can only prescribe, like for dental surgery, like maybe 3 days of pain medications. And it's also educating doctors and the public that some things that I think the other thing that has been contributing to this is a lot of times maybe we could have treated something with Tylenol or naproxone or a much milder pain reliever, where instead of throwing like the strongest thing at people. So I do hope that the use has gone down a little bit now that we're able to check. I think we're able to weed out the people who are seeking it out. We're at least able to put some stops into the process. And I know the DEA is saying or trying to propose that manufacturers don't make as much. Where I have concern there is a lot of people really do need these medications. Like cancer patients can take a lot of pain medication, and it doesn't even touch their pain. So we don't want to make it harder for the people who really need it to not be able to get it, which is where this database helps us too, because most of the time those patients are getting their medications from the same doctor instead of jumping around to 5 or 10 different doctors to get pain medication.
Yeah, absolutely. And then, while you were talking, it also kind of sort of came to me a little bit. Sometimes the doctor may not just absolutely be at fault, but perhaps maybe they may have felt that, well, I can feel this, just like if you're talking to an individual, you perhaps maybe can feel their pain or see the expression on their facial countenance or what have you. And so perhaps maybe the doctor was trying to do their best to relieve the pain for the patient, and perhaps maybe was not aware that the person, because sometimes individuals will come into the office and say, well, I need this, I need that, and their intentions may not be related over to the doctor, but the person, the patient themselves, they know their intentions of trying to abuse the drug because it's making them feel on cloud 13, but the doctor may not be aware of that. So some of this may be 50-50, where the doctor may not have been aware of what the patient was doing, and they were falsely accused, for over-treating the patient.
Yes, exactly. And the thing with pain is there's no way for us to measure pain. Like something that is painful to one person might not be painful to the other. Some person might have a 10 out of 10 pain. We all have different sensitivities. So a doctor can't run a test and say, well, you are in pain or you aren't. Like you said, they just look at the person and assess as best they can.
Wow. Yep. I was thinking about, and May should not reflect on it, but I was thinking about, there was a doctor back in I think it was back in the 90s or maybe the early 2000s. And so they looked upon him as being very mean, Dr. Kevorkian. And so he would go in and he would get the patients out of their misery and what have you. But as you stated, sometimes I kind of see his point, and sometimes I can see the other, the family members' part of it too. And sometimes people just don't like pain, but sometimes a physician or a pharmacist perhaps maybe can measure the pain according to how the person is, presenting themselves. And, of course, it's going to show on the outside as well if they have a back pain or a stomach pain or something that's going on. And so maybe, we perhaps maybe have been too harsh on the physicians and the pharmacists as to them prescribing medications, and they not be aware of the patient's motives, I guess I would say, in regards to the medicine.
Right. And I think, on the other side, I think now that the opioid epidemic is being identified, like the manufacturers are trying to do their part, the doctors are trying to do their part in education, the pharmacists are trying to do their part in tracking. So I think there's new things that are happening that are supposed to help make the opioid epidemic better, but like we know, if where there's a will, there's a way. So if you really want to get that medication, a lot of people will still find a way.
Absolutely. So I guess the next question would be regards into campaigning. We were at a local event where I think Blue Cross Blue Shield, and that's who they are, and they were making a presentation at the luncheon and in regards to taking prevention steps of trying to reduce the drug of opioids. And so my opinion on that was I think they were given like a huge grant, and it was over several $1,000,000. But to me, my take on that is for as their appearance on Facebook and sending Miss Tennessee out to be able to advocate for it was, I guess, not enough. It wasn't enough. We was kind of stirred at the luncheon. It was a women's business luncheon, and we was kind of stirred because it was a lot of questions asked to Blue Cross Blue Shield as to the $1 million that they had received, but they felt that some of the attendants felt that that was not a stronger approach, to the state, or in regards to reducing that $1 million. If I had $1 million, I could do more than that with a grant. So in regards to me making that statement, I could do a lot with trying to reduce opioid drugs than just doing it on Facebook, because everybody, take for example, if I'm on Facebook and I take opioid drugs, that is not going to do anything for me. I'm not going to look at that. I'm going to go away from that ad campaign. And so I was kind of concerned about it, and we were frustrated, and some of us were angry, but some of us held our, peace, and some of them spoke out. So in regards to what I just stated, what are some campaigns that you have seen or that you would like to work on in the near future with other pharmacists or physicians or other accolades in your community to be able to advocate this epidemic?
That's such a good question, because I do think this is, even like when you lump this in with mental health in our country, this is where we are lacking. And I think just supporting the physicians who are treating these patients, giving them more access, and encouraging more people to be doctors who treat this, I think, is one way. I think if someone really wants help, or if a family member wants to help one of their family members, even your local pharmacist, because I know the people listening are all from different parts of the country, they'll be able to pinpoint like the place that's closest to you. There's a National Substance Abuse and Mental Health Administration hotline, and I know that hotline, I think it's 1-800-662-HELP. I think that hotline also will help direct you to like your local area that has the most support. But as far as like what I would like is, I've been trying to get involved more with mental health and just helping people realize that there's resources out there. A lot of people suffer in silence and they feel alone. And I think the number one thing is you aren't alone. Like, no one's alone. If one person is feeling like that, there's probably 1,000 more. And I think just enabling people to be strong and ask for help, because that's really, I know they say that's the first step, but it's the hardest step. And just being there for your friends and your family members and your coworkers, and with like a no judgment attitude, I think is one of the biggest things we can do. And as a pharmacist, since we see those people every day, I think having the attitude, because I know a lot of times people feel like they go in and maybe get judged, but having that attitude, that like treating the whole patient, like, how do you feel today? And how can I help you? And is there anything you need? I just think taking that time to be a friend and a resource as a pharmacist will go very far, and that's how my profession can help.
Absolutely, absolutely. So thank you so much for all of the information that you have given us on today, Dr. Lewis. It has been a wonderful time on this platform with you on Women Who Rock Investigates. And so before we leave, we would love for you to be able to share with the audience of how they can follow you, how they can find more information about you and your practice of what you do.
Absolutely. So my blog is thepharmacistguide.com. My email address is thepharmacistguide@gmail.com. Just give it out to everyone. And my Instagram is @pharmacistguide. And I'd be happy to answer any questions. If someone needs support, from opioids or addiction, I'd be happy to help. So just reach out.
Perfect. So we have had Dr. Joanna Lewis, expert pharmacist in the areas of drugs and medicine here on Women Who Rock Investigates, and you have gotten an unbiased preview of how you can be able to ascertain the meaning and be able to ascertain, what is being done in the medical industry in regards to this epidemic. Joanna, thank you for being our guest on today. We hope to be able to hear from you later on in the year. Hopefully we'll try to follow up with you in regards to more information, facts, and statistics in regards to other medicines that perhaps may be able to help or what needs to be done to prevent it. So until next time, ladies, you take care and have a great day.